China has lifted tough restrictions on the province, really at the epicenter of the coronavirus outbreak, after a months-long lockdown. As the country reported no new domestic cases, the lockdown lifted then on more than 50 million people in Hubei province, with residents now allowed to leave the region if healthy, with some airports and train stations opening. The city of Wuhan, the real initial epicenter of the outbreak, will allow residents to leave from April the 8th. Now, China reported 47 new infections in the last 24 hours, but all of them were imported infections from overseas, mostly Chinese nationals returning home. Earlier, I spoke to our correspondent in Beijing, Charles Pellegrin, and I put it to him that the risk of a rebound in infections still exists amid doubts, really, on the transparency of the data published by China.
Let's take an example on the data that was released this Wednesday. 47 new infections in mainland China, all of which are imported from abroad. But these daily figures don't take into account asymptomatic carriers. Those are people who are carrying the virus but not showing any symptoms. Chinese authorities don't consider these people to be officially sick, and this goes actually against the WHO guidelines. Now, these asymptomatic carriers can still transmit the virus, and potentially in the next 2-3 weeks, as restrictions are eased, could travel around the country. Now, the question here is, do the authorities here in China know who these asymptomatic carriers are? Authorities said that they do. These people are accounted for and are currently in isolation. But some estimates say that these cases could represent as much as a third of all positive cases. So are these people really tallied, really accounted for, really followed? We'll know in the next few weeks if we see a flare-up of new infections in the country.